Good evening. My name is Promise Suhiri. I'm a fourth-year pharmacy student at Ben and Métis Fresh College of Pharmacy, and I'm going to be speaking to you about the medication Mometasone and Formoterol. The brand name for this medication is Dulera, and it is an inhaler. So why are you taking this medication? The first thing to know that this medication is a component of two different drugs. The first one is Mometasone, which is an inhaled corticosteroid that acts by having an anti-inflammatory effect that helps prevent airflow obstruction in the lungs and also decreases other symptoms that you may experience, while Formoterol works by relaxing your lung muscles and helps improve the lung function and decrease the risk of exacerbation or hospitalization. This medication is FDA approved for the treatment of asthma and can also be used for COPD symptoms. It is not a rescue inhaler. If you do not know what a rescue inhaler is, you probably want to reach out to your physician or your pharmacy to ask what a rescue inhaler is. If you do not think that you have a rescue inhaler, it is important that you request one from your doctor, but this medication is not a rescue inhaler in the case of an exacerbation. So what should you tell your doctor before you start taking this medication? You should let your doctor know if you're using any other medications similar to this. Are you taking other, are you using any other inhalers? If you're not sure, just reach out to your pharmacist and they will provide you more information on what medications you're currently taking. And also, if you have experienced any allergic reaction to any component of this medication, like I listed previously, this medication does include two different drugs, Formoterol and Mometasone, which are also provided in the market as individual medications. So it's important to know if you have reacted to either of these two medications before individually. And also, it's important for them to know which other medications you're taking, prescription, over the counter, because some medications have potential of interacting with this medication and can cause the medication not to work properly or the way it's supposed to. And then you also want to be sure to let your doctor know if you have used this medication for any other reason other than asthma and COPD. And also tell your doctor if you're currently pregnant or breastfeeding, are you currently diabetic? And also tell your doctor about any other health conditions they might possibly have before they can prescribe this medication for you. So how do you want to use this medication, or how do you use this medication? The first thing is to make sure that you're following the instructions that have been provided to you on your prescription label. That's very important. But here, I'm just going to mention a few pointers, important things to know before you start using your medication and how to use it properly. The first thing you want to do is to prime this inhaler before you start using it. So as soon as you open that packet, you want to make sure you prime it. And if you have not used this inhaler for about 5 days, we also recommend that you prime it again before you start using it. So I'm just going to walk you through how to prime the inhaler, how to properly take a dose in, and what to do in terms of storage, and how to go about missing a dose if you do miss a dose. First thing, so how do you prime your inhaler? First thing, you always want to shake this inhaler before each use. So before priming it, and always shake it for every time you have to use it. So we have to shake it before every use, and then you want to spray 4 times into the air away from your face. This inhaler does come with a dose counter. So initially the dose counter would say either a 64 or 124. You want to keep an eye out for that. And after you're done priming it, the dose counter should come down to a 60 or 120, depending on the size inhaler that you have or that was prescribed to you. So how do you take in your dose? You want to first breathe out fully and then try as much as possible to let out as much air as you can from your lungs without stressing yourself out. And also put the mouthpiece just in front of your mouth while you're doing this, and let the canister just stay upright. And then you're going to open your mouth and breathe in slowly and deeply, just as if you're yawning. Close your mouth around the mouthpiece, and at the same time you also want to press firmly down on the top of the canister, and this is actually how you get the dose of the medication. And then you want to hold your breath for about 5 to 10 seconds and breathe out slowly. If you do have to use more than one dose, more than one puff, we do recommend that you wait for 1 to 2 minutes before inhaling the second puff, and all you have to do is just to repeat the same steps as I've mentioned previously. And then always remember, wait 1 to 2 minutes before you inhale the second puff, and make sure you're shaking the inhaler before you take the next dose. You always want to shake the inhaler before you use it. And after you're done taking your dose, you have to rinse your mouth after each use and spit out the water. We do not want to swallow the water. Whenever you use this medication, you have to spit it out and then go ahead and put the cap of the inhaler over it and just keep it or store it at a regular place where you usually store your other medications. So in terms of maintenance for this inhaler, we do recommend that you do clean the mouthpiece for this inhaler at least every 7 days or after every use. You have to clean it with a dry wipe. We don't recommend you running the inhaler through water or using a wet wipe to clean the inhaler on the mouthpiece. You just want to use a dry wipe to wipe around the area of the inhaler where your mouth comes in contact with the inhaler and just replace the cap for the inhaler after you're done. So what do you do if you miss a dose? It just depends on how many doses you're taking per day. So if you skip the dose or if you skip a dose, we do recommend that you go back to your normal routine or the normal scheduling for this medication. We don't recommend that you take 2 doses at the same time or try to take an extra dose because you have missed 1 dose. Just go back to your normal routine like you have been that has been specified to you on your prescription label. Just follow that. If you're concerned or you have more questions, just call your pharmacy or just call your doctor and have them provide you with more advice on what to do if you have missed a dose. And what side effects do you want to expect or watch out for while you're using this medication? Very serious side effects would be things like hives or itching, swelling of your mouth or your nose, difficulty breathing after you use this medication. These might be signs of anaphylaxis, which means that you're having a serious allergic reaction to this medication. Go ahead and call 911 or have someone call 911 for you and reach out to an emergency care unit as soon as possible. Some other mild adverse effects might be dry mouth, high blood sugar. Like we said previously, if you are diabetic, reach out to your physician and let them know that you're diabetic before they prescribe this medication for you. Mometasone, which is a component of this drug, it is an inhaled corticosteroid and they are known to increase the blood sugar. So that might be one reason why some patients who are using this medication might actually see their blood sugar go higher than usual. But if you are diabetic, that might be a different case for you. It is a different case for you. So let your physician know before they prescribe this medication for you that you are diabetic. You might also experience dizziness, difficulty sleeping, being shakiness or trouble or low potassium levels. Low potassium levels might present as muscle cramps or a heartbeat that doesn't feel normal. If this persists for more than 1 day or 2, you probably want to reach out to your doctor or reach out to an emergency care unit and let them know that you're experiencing this type of adverse effect, and they might decide to revisit the instructions on how you use your medication or try to prescribe a different alternative for you. So how do you store this medication? We want to store it at room temperature in a dry place. Always remember to keep your inhalers away from open flames. If you are a current smoker or if you do smoke, make sure you're not smoking around this medication. Make sure you don't keep this medication in a place where it's going to come in contact with light. Keep it in a dry place. We recommend you to keep it probably at your nightstand so you can remember to use it. And also this area is usually dry and away from moisture or an open flame, and likelihood of it coming in contact with anything that could alter the components of the medication is lower. And then always protect it from heat and open flames. Do not puncture the canister. If the canister is empty, you want to go ahead and discard it as you are directed. Do not puncture it because it does have a potential to be flammable. And this is all I have for you today. If you do have more questions or you need more inquiries, the website for the manufacturers that actually make this medication actually provides good information on how to use the inhaler, what to look out for while using the inhaler, and things to know for those who are using this inhaler. Or you can contact your doctor if you feel like you would like to try this medication out, or reach out to your pharmacy for more information on the drug. Thank you and have a good day.